Hi, my name's Brad Siff. I'm the founder and president of BioWave. This video will teach you how to place your pads for shoulder pain. When you receive your BioWaveGO box, inside the box you will find the BioWaveGO unit, a lead wire cable which connects the unit to the pads. Pain relief pads, there's 3 pair in here. I've removed one of the pair for this demo, and then the AC charger that comes with the unit. So the very first thing that you want to do is charge up the BioWaveGO unit. So the port on the bottom of the unit here is where the charger plugs in, and the other end of the charger plugs into a standard wall outlet. It takes about 1 hour to charge up the unit. The LED bars on the front will be bright green as it's charging. The top bar breathes in and out, and once all the bars are lit and they are solid green, then you know that the unit is fully charged up. Once that's done, then you'll be ready to start the treatment. So the very first thing that we want to do is we want to plug the pads into the end of the connector. Either pad can plug into either connector. The orientation of the pad doesn't matter, and you don't have to squeeze the prongs, just push and it clicks in place. And we do the same for the second one. Again, either one can plug into either pad. To remove the pads from the cable, the connector purposely sticks out this far so you have something to grab onto. So you just pull it straight apart. You don't have to squeeze the prongs to remove the connector from the pad. Now we're going to start treatment, and as the example, we're going to use general pain throughout the shoulder, as if, for example, as if you had pain from osteoarthritis in the shoulder. So before we place the electrodes, we want to clean the skin. We have a towel that we pre-wet with some water. So we're going to rub the 2 locations very thoroughly. We want to get off dead skin cells, lotion, oil. This will allow for better electrical conduction of the signals through the skin. So now that we've cleaned the skin, we can place the pads. We identified one spot as toward the top front of the shoulder in this location here. The other location for general shoulder pain is toward the top back of the shoulder. So we're here. These pads are about 1 inch apart from one another, okay? The next step is we want to connect the other end of the cable to the device. This plugs in on the 45-degree angle right here where the port is. You just plug it in and it clicks into place. This can rotate. To turn the device on, the power button's at the top of the device. We hold it down and the LEDs turn green. That's your battery status. Then they turn white. White is your countdown timer. We haven't started the treatment yet. To start the treatment, we're going to press the plus button. When we press the plus button, the LED bars turn blue. Blue is your intensity. As you press the intensity button, the bars will start to increase the more times you press it, and then after 3 seconds, if you're not pressing the intensity button, the bars turn white, and that's your countdown timer. During the course of the treatment, the body adapts to the electrical field, and as the body adapts to the electrical field, the sensation that you feel will diminish. So as the sensation diminishes, you want to hit the plus button to keep the intensity strong. You want the sensation you feel beneath these 2 pads and inside your shoulder to be as strong as possible, but still comfortable. At the end of the treatment, the intensity will automatically shut off, but the device is still on. So to turn the device off, hold the power button down for about 2 seconds until the LED bars turn dark. Now we're going to talk about the different types of pad placements for many different types of shoulder pain conditions. The first one I'm going to show has to do with general pain throughout the shoulder. For example, if you had osteoarthritis of the shoulder. So generally, when pain is felt throughout the entire shoulder, we can place one of the pads on the front of the shoulder toward the top, not all the way on the front, but more toward the top of the shoulder, but on the front side like this. And then we can place the second pad toward the back of the shoulder. You could be right where, this is where the edge of the shoulder blade is, and have the second pad here. There's about an inch or a little bit more of spacing between these two pads. If someone has pain just on the front of the shoulder, this could be, for example, from biceps tendonitis. It typically presents right at the head of the biceps tendon, which is right here. We would place one electrode directly over that location of pain on the front of the shoulder. And then if there's no other painful location, this second electrode gets placed over the bony area right at the edge of the shoulder blade toward the back top of the shoulder. And that's a comfortable place to receive stimulation. You're not limited by how much intensity you can take over the pain site on the front of the shoulder. If you have pain that presents on the back of the shoulder, for example, an infraspinatus type sprain or issue, maybe it presents more in this location here. If that's where the pain site is, that's where you're going to place this pad. The second electrode would go, if there's no other location where you have pain, right back toward the top of the shoulder where it's this bony area, which is a comfortable place to receive the stimulation. So you're only limited in how high in intensity you go up by what you feel at this location, which is the pain site. Another example is for like a rotator cuff tendonitis, that might present toward the edge of the shoulder. So you palpate, find that location where it hurts the most, put this electrode directly over that location of pain. This electrode needs to be at least 1 inch away. It could be toward the front of the shoulder, or it could be further along the edge of the shoulder blade, which goes right here. And we can place this second electrode in this location. So here the electrodes are 1 inch apart from each other. This is the primary treatment area if that's where the pain is presenting. The device is wearable. It has a clip on the back, and to use the clip, you press at the very top of the clip. Make sure your thumb is above where the plus button is, so you're not hitting the plus button, and you just press the clip, and then you can clip it on anything where you want to wear it. So for example, if you want to clip it on your pocket, you just press the clip and then slide it on your pocket, and you can actually walk around with this.